U waves typically follow the T wave on the ECG paper, and they're always typically in the direction of the T wave itself. They tend to be 1 to 2 millimeters in size, and they're thought to occur due to delayed repolarization through the Purkinje tissue system. They're typically as well seen in slower heart rates, so patients or athletes who have a bradycardia, which may be physiological or pathological, tend to demonstrate U waves more clearly on their ECG. What you're looking for is a wave in the same direction after the T wave that's best seen in V2 and V3. So there are a number of causes of abnormal U waves. Prominent U waves by definition are U waves that tend to be greater than that normal 1 to 2 millimeter in size. Typically the causes of prominent U waves relate to electrolyte imbalances, miscellaneous pathological conditions, and certain antiarrhythmic drugs. So looking at electrolyte imbalances, patients who are low in potassium, low in calcium, low in magnesium, or have a low temperature tend to have or are predisposed towards having prominent U waves on their ECG. Patients also who have raised intracranial pressure or who have an enlarged heart or have hypertrophic cardiomyopathy also may have prominent U waves. In terms of the medications, generally it's antiarrhythmic drugs, and in particular remember digoxin as a drug that's associated with prominent U waves. Inverted U waves are a sign of myocardial ischemia or infarction. So they're associated with coronary artery disease of some accord. So that sums up U waves. Know that they follow T waves. They typically are in the direction of the T wave. They're about 1/4 of the size, and they're 1 to 2 millimeters in size. And they're more prominent both physiologically in people who have slower heart rates, and are more prominent in certain heart conditions, metabolic conditions with certain drugs, and can be inverted in cardiac conditions